welcome back to Healthy Hands. Today we're going to talk about jersey finger. So I myself have suffered from jersey finger, and I can tell you as a therapist, it's one of the most frustrating and longest healing and treatment protocols that there is out there. A lot of it, the whole thing actually, is all based on proper positioning of the joint and splinting and a ton of education to the patients. So what is a jersey finger? Typically, it got its name from, if you can imagine, you're out on the football field and you go to reach for someone, your finger gets stuck on their jersey and it just hooks onto their jersey and then gets pulled away and snapped really quickly. There's a disruption of the extensor tendon of the distal joint of the finger, and it could happen to any finger. So it's an extensor tendon injury, and what you're left with is a finger that just bends at the tip. You have no ability to lift the finger up into full extension. Some people do experience pain, some people don't experience pain at all, and they look down and their finger is just bent. Jersey finger is technically called a mallet injury, a mallet finger. You can have a soft tissue mallet finger, or you could have a bony mallet finger. So a soft tissue is just that the soft tissue has either attenuated or stretched, and you lose the ability of the excursion for full terminal extension. If it's a bony mallet, you have actually experienced an avulsion fracture, where the part of the bone where the tendon inserts into the bone has ripped off and it's fractured. They are typically handled with a pin, closed reduction percutaneous pinning, where the surgeon will take a pin, reset the injury and pin through that first joint, and that pin will stay somewhere between 6 to 8 weeks. If it's a soft tissue mallet like the one I had, I immediately put it up into hyperextension. I've got pictures here. I think I used initially a couple Q-tips with some tape until I was able to get to the pharmacy, where I used Alumafoam. I use paper tape a lot in my treatment. It's very porous, so it's okay to leave on the skin for longer periods of time, as opposed to any kind of other adhesive athletic tape, which is only worn for an hour or so while you're playing your sport. There is a taping technique that works exceptionally well. In fact, I myself use this taping technique to splint the finger. Now this is 1-inch paper tape. It does come in a 1/2-inch size, which for fingers works a little bit better. But this is the taping technique. You would have your hand flat on a surface to ensure that the joint is kept up in hyperextension. I'm coming right to the crease of that middle joint. Okay, I'm bending the finger so you can see where I'm going. So the tape sits right at the crease of that middle joint. You're going to use tension on the tape as I lift up and push the finger into hyperextension, and then come right over top of the finger and place it back down. So you can see just with the tape how the tip of my finger is now in hyperextension. It's okay to be bending the middle joint. You'll end up with what we call a straight fist that looks like this. All we're trying to do is maintain hyperextension of that distal joint. You can do this to any finger. So this is extra, I can tear it off. So I'm left with, now if this was a 1/2 inch piece, it would look a lot more streamlined. But essentially, I can use the hand, I can grab with my other fingers, and it's still holding in extension. You may use a second piece also to wrap right around the base of that first piece, and all that does is anchor it so that it won't fall off. This can get wet, it's okay. It's gonna get dirty because it's on your hand, that's okay too. But this technique has to be maintained, here's the kicker, for 6 to 8 weeks, 24/7, 100% of the time. When you change the tape, I'm gonna do it right now with you. When you change the tape, you have got to make sure that you maintain hyperextension, okay? So as I lift up, I'm gonna place my finger flat down on the table into hyperextension, and I'm gonna take off the tape. I never let the finger go into either neutral or flexion. It's got to stay in hyperextension. So it's either supported on the table flat, or I'm using my other hand. As the reason for this is that as soon as the pressure is off and I let the finger do what it wants, because it wants to do this and sag, all the adhesions that have formed on the volar side of that joint just broke. So now your clock starts over at day 0. You're trying to limit the number of episodes that happens because you want the clock to keep ticking and not constantly go back to 0. I've mentioned in one of my other videos about the oval 8 rings. The oval 8 rings work really well once you get past week 6. And the reason for that is these oval 8 rings will only hold you at 0. They will not hold you in hyperextension. You see that? So this works, but you've got to have a little bit more healing time to the volar side of the joint before this can come into play. But this is acceptable, but it's not acceptable for those first 4 to 6 weeks. I just want to say thank you so much for watching. Please be sure to like this video and subscribe. Hit that bell so that the next time I upload my next hand pain video, you can be alerted. I appreciate your time, and thanks again for checking out Healthy Hands. Definitely, please be sure to leave a comment or even a question below. Maybe even send me a picture of something that you're dealing with right now, and I'd be happy to troubleshoot home treatment with you for sure. Thanks again.